Good morning, everyone. I am Pauline Castellan, IFRC Disaster Law Delegate for Central Asia. On behalf of the IFRC Central Asia Country Cluster Office, I would like to welcome our honored speakers, panelists, and guests to the Central Asia launch of the IFRC Guidance on Law and Public Health Emergency Preparedness and Response. This webinar is a joint effort of the Disaster Law and Health Programs of the IFRC office in this region. IFRC supports the humanitarian services provided by Red Cross and Red Crescent national societies in the Central Asia region in times of emergencies, including for COVID-19. IFRC is always ready to alleviate the suffering of the most vulnerable people in the region, and we support our Red Cross and Red Crescent national societies in ensuring that humanitarian services are done in accordance with the 7 fundamental principles of humanity, impartiality, neutrality, independence, voluntary service, unity, and universality. Since 2003, the International Federation of the Red Cross and Red Crescent Societies, through its disaster law program, has been supporting governments and Red Cross and Red Crescent societies around the world on strengthening laws and policies on disaster risk management in order to save lives and help build the resilience of the most vulnerable people. An effective way that we can reduce human suffering due to emergencies, including public health emergencies, is not to wait and respond, but rather to already act before such emergencies happen. Indeed, part of IFRC's core priorities is strengthening legal preparedness, which means that even before a disaster strikes, our organization is already looking for ways to support governments in developing good laws and regulations that can clearly provide the responsibilities and rights of actors in such emergencies, including COVID-19. When COVID-19 happened, we soon realized that most domestic laws and regulations governing disasters, including health emergencies, were not adequate to address the very unique and terrible consequences of this pandemic across the globe. It is in this context that we are holding this regional launch of the Guidance on Law and Public Health Emergencies. This webinar seeks to do 2 things. The first one is to spread awareness among Central Asian governments, Red Cross and Red Crescent national societies, humanitarian, health and development partners regarding the recommendations of the guidance on how to have better legal preparedness for public health emergencies in the region. And the second objective of the webinar is to gather insights from these actors regarding Central Asia's experiences on legal preparedness for COVID, and thereafter use these insights as evidence to positively influence the discussions at the World Health Organization negotiations on a proposed pandemic treaty, as well as the ongoing review of the WHO international health regulations in light of the lessons learned from COVID. Of course, it is important for us to first have a common understanding of what a public health emergency is. So the WHO defines a public health emergency as an occurrence or imminent threat of an illness or health condition that may be caused by bioterrorism, epidemic or pandemic disease, or a novel and highly fatal infectious agent or biological toxin that poses a substantial risk of a significant number of human fatalities or incidents of permanent or long-term disability. Such a definition of a public health emergency actually falls within the definition of a disaster. But our research shows that public health emergencies can sometimes be regulated separately from other types of disasters and through separate laws, policies, and plans. However, at the international level, there has been increasing emphasis on integrating policy and legal frameworks for disaster risk management and public health emergencies. One such example, which will be discussed by our colleague from the UNDRR Central Asia office later on, is the Bangkok Principles for the Implementation of the Health Aspects of the Sendai Framework, or in short, Bangkok Principles. These principles recommend the systematic integration of health risks and biological hazards into disaster risk management laws, policies, and plans, and conversely, the integration of disaster risk management into health strategies and systems. It is not very clear how the Bank of Principles propose to implement integration, or how integration means in practical terms. Therefore, we believe that this gap can be clarified by updating laws, regulations, and policies on disaster risk management and public health emergencies, and that is why we developed this guidance that we are sharing with you today. So you can see here some information on what the guidance is all about. It is composed of 9 questions that can provide government officials and those supporting them with a structure for reviewing existing laws, policies, and plans on relating to public health emergencies. By using these assessment questions, it can help governments and policymakers strengthen and identify the gaps in the legal framework. It can also help in drafting or revising legislation if such is needed. And also, it can provide a way to assess whether implementation of existing laws and regulations on public health emergencies can be or should be improved. So this is an overview of the 9 questions that you will find in the guidance on law and public health emergency preparedness and response. I will try to do my best to go over them quickly and just give you an idea of what each question seeks to ask. So the first question you'll see here is asks about how laws and policies in your country establish a strong institutional framework for managing public health emergencies. And this question covers the availability of clear definitions of the coordination structure for public health emergencies and of the role of each type of actor, including non-medical personnel, frontline responders, and the communities who are themselves affected by such public health emergencies. It includes assessing whether laws support a whole of society and whole of government approach to managing public health emergencies, as well as having a multi-hazard emergency framework in your country. So when we say whole of society, it implies the inclusion of communities and local actors in any preparedness and response efforts to public health emergencies, both from the design phase to the implementation phase. Lastly, it also asks whether laws, policies, and plans on public health emergencies adopt an all public health risk approach that encompasses all types of biological hazards and addresses all phases of public health risk management. Starting from risk reduction and going through to preparedness, response, and recovery.
All right. So we are now on the second question, which is regarding the integration and coherence between broader disaster laws and policies and broader disaster laws and policies with public health emergency laws and policies. We have seen that in COVID-19, a lot of these laws are really working in silos or separately. And some laws on dealing with health emergencies are actually very old, some dating as nearly as 100 years old, and they need to be updated. The third one focuses on the issue of compliance, implementation and compliance with the international health regulations, which will be discussed later on by our colleague from the WHO. But the IHR is very important in terms of providing the international framework for how public health emergencies should be managed. So our guidance recommends that there should be some form of assessment as to how laws identify who the government focal points are for the implementation of the international health regulations in each country. The fourth question talks about public health emergency preparedness, early warning, and early action. It talks about the need for an obligation by states to alert their own populations as to the existence of a public health threat or event. It is very notable that under the international health regulations, states do not have a duty to notify their own population. They do have a duty to notify the WHO of all events that may constitute a public health emergency of international concern, but such obligation as to their own populations is not really mandatory unless it is stated in domestic law. This question also tries to address the responsibility to create contingency plans for public health emergencies. The fifth question talks about states of exception. So it asks governments if its laws or policies establish a mechanism for states of exception that can support effective response to public health emergencies. So it covers how a state of emergency is declared during a pandemic or epidemic, and how such declarations are made, by whom, and for how long such a state of emergency should last. It also covers assessing what should be the emergency powers of the government that are embodied in such a declaration, focusing on the importance of the proportionality of the powers in that declaration to the actual needs created by a public health emergency like COVID. The sixth question talks about or asks countries on how its laws provide legal facilities to humanitarian actors for public health emergency preparedness and response. This question covers the importance of providing legal facilities for humanitarians, including reasonable exemptions from COVID-19 restrictions, to ensure that they can still provide aid to people, especially in remote and underserved areas during a pandemic. The seventh question asks whether a country's laws and policies minimize the incidence of forced immobility and its negative impacts during public health emergencies. So it seeks to balance the international human right of persons to travel vis-a-vis the need to control or close borders during a pandemic for the sake of safety and public health. It also talks about border and travel restrictions, assessing whether they are consistent with international refugee law and international human rights law, as well as what are the appropriate criteria for declaring these kinds of travel restrictions, and what kind of assistance will be given to people who may be stranded or who may wish to be repatriated to their countries during border closures. The eighth question asks whether laws and policies are able to ensure the protection of vulnerable groups during public health emergencies. And this one is very close to the advocacy of IFRC. So it covers protections for marginalized populations, including migrants, and how they can access public health services and information during states of emergency or states of public health emergencies. So it's important to note that COVID-19 has illustrated that vulnerable groups may not only be at a heightened risk of primary impacts or health impacts, they are also more vulnerable to severe secondary non-health impacts during a public health emergency. For example, loss of jobs, increased incidence of sexual and gender-based violence, educational disruption due to school closures, difficulties for people to access health services and social care, and as mentioned, forced immobility. Lastly, the last question that the guidance proposes for governments to use when assessing their laws is to ask whether there is a mechanism for regularly reviewing and updating public health emergency laws. So that, in a nutshell, is what the guidance on law and public health emergency preparedness and response is all about. I want to share with you a video that tries to encapsulate what I have just discussed. So I hope you can hear the audio of the video. Please message me if you cannot hear it. So let me just play it now.
Pauline, there is no audio for the video.
kuruluda.
Great. So did you all hear the audio? I hope it was clear.
No, we couldn't hear.
Oh, you couldn't hear the audio. Okay. Should
Can
I
you
play it?
again? Yes.
Okay, I'll try.
Okay, apologies.
Приносим.
Hear the audio, but I think we need to,
We cannot hear the audio, but I think we need to move on to the next part of the launch. So let me stop sharing my screen. Okay. Okay, so at this point, I would like to welcome each of our resource persons for this first part of the launch. So first, I would like to introduce Dr. Oyon Gerel Amgaa, Health and Care Manager of the IFRC Central Asia Office. Dr. Gerel Amgaa works for the IFRC as a health manager for Central Asia. Based in Bishkek, Kyrgyzstan. She has been leading the COVID-19 response in Central Asia for IFRC since 2020. And prior to this, she worked for IFRC as head of health unit for Asia Pacific and as health coordinator for East Asia and Southeast Asia regions. She was involved in IFRC response to different pandemics and epidemics that affected Asia Pacific countries during the last years. Dr. Gerel Amgaa is a medical doctor by training and holds a Master of Public Health degree from the School of Public Health of Boston University. She will be speaking to us today to provide an overview of lessons learned from the Red Cross and Red Crescent operations in Central Asia for COVID-19. So over to you, Gerel.
Thank you, Pauline. Can you all see my screen?
Yes.
Okay, then I'll start. Good morning, everyone. Thanks for joining this launch. I know for some of you it was very early hours. So I would like to share with you the lessons learned that we have had from our collective response by Central Asian national societies in response to COVID-19 pandemic during the last 2 years. So I think we all have felt the same experience, and I would say that it was a really challenge of our lifetime. And I'm proud to say that the Central Asia national societies have really rose to the challenge. they started, I remember that in the very first months of the, when just news about the first cases of COVID-19 started to trickle, and there was not even a first cases reported in Central Asia. Already the Central Asian societies were started to start preparing for it. They were really at the forefront of the national response. So they were actually coordinating with their actions with their own national emergency health coordination mechanisms with their own Ministry of Health and other government authorities. One of the key aspects of the national society's response was the risk communication, and later on the promoting COVID-19 vaccine as they become available. This was a new disease, and people had to be explained what is this disease about, how they can protect themselves and their loved ones from this disease, and what they can do to minimize the risk in their communities. So the national society's staff and volunteers were quickly trained on the key messages, and educated people with these messages. Based on the request of the health authorities, some were engaged in also providing additionally different health and care services. And these ranged from providing first aid, or providing ambulance services, or offering mental health and psychosocial support. And also, like the socioeconomic impact of the pandemic was really enormous. And in response to that, national society responded with a number of, with a range of different activities. One of the key activities was the distribution of multi-purpose cash grants especially to the most vulnerable individuals and communities, and also offering creating self-employment opportunities for people who lost their jobs during the pandemic, and other livelihood activities. And also the national societies used this also momentum to strengthen their capacities to respond to disasters and future public health emergencies. And now, as the COVID-19 vaccines have been rolled out in all countries, many national societies also launched on critical work of promoting COVID-19 vaccine, explain to the people the benefits of of the vaccination, dispelling the rumors and misinformation about the vaccination, and also where it's needed, physically accompanying people to vaccination centers, and especially for people who have had difficulty with accessing the vaccination sites, or they facilitated the visit by government mobile vaccination teams to their homes and communities. So at the moment, we have 3 national societies doing this COVID-19 vaccine promotion work. That's in Tajikistan, Kyrgyzstan, and Kazakhstan. So I would say that all these national societies have been providing this service in very difficult and challenging situations. And also, as we all know, the Central Asia is very prone to disasters, and the disasters don't stop because of pandemic, and therefore national societies continue to provide and respond concurrently to other ongoing or new emergencies in their national context. Okay, so what we have learned from all these responses, I think we knew all along, but I think this pandemic highlighted even more how the legal preparedness is a really key component of our effective of preparedness for public health emergencies. Also, that I would like to say that also it demonstrated the vital role that national societies can play in their auxiliary roles to national governments and first responders in public health emergencies. It also brought opportunities for them to strengthen their links to their own governments. And as the result, the national societies were also able to increase their visibility, credibility, and profile in their context. But now the challenge is to how to make sure that these experiences we turn in collaborations, we turn into long-term partnerships and collaborations in the future public health emergencies, and have auxiliary roles better recognized and reflected in the domestic legal frameworks. Also, Pauline in her presentation also mentioned about the movement restrictions during the pandemic, and this was really one of the challenges that really compound the response of national societies. So the national societies had to adapt to this circumstance very quickly, and I would say that being joining, supporting them in the responses, I was amazed how resourceful some of these national societies were in finding ways to continue providing the essential services. For example, that I know national societies digitalized some of the services they provided online where they couldn't really reach the communities. They also limited, they adjusted the food distributions. So by limiting the direct contacts with the people, for example, during the movement restrictions, for example, by dropping the food parcels, hygiene parcels, and other essential goods at the doors of people's homes. And the national, based on their request, national societies were granted exemptions from the movement restrictions when it's possible. I know that just to give one example, that in Kazakhstan, the movement restrictions were very severe, especially in the first months, as it is in other countries. First months of the pandemic, in Red Crescent Society of Kazakhstan, staff and volunteers were provided with passes which allowed them to move during the lockdowns. But overall, I would say that although they were granted these exemptions, not necessarily the exemptions were provided on time. And we have to, and also that in those situations, often the national societies were the only ones who, from among civil society organizations, who could continue providing these services. For example, just give an example from Kyrgyzstan or Tajikistan, they continue to provide very important services like mental health and psychosocial support and tuberculosis case detection work. However, overall, although despite this best efforts and the movement exemptions, it's restricted, severely limited the access for national societies to communities, and especially in the first months of pandemic. And we have to do better in the next time. And we have to highlight that the auxiliary roles of national societies spelled better in the domestic laws, and the national societies and governments should work together, so the governments provide necessary legal facilities or exemptions from movement restrictions. And we need to advocate for this now. as a part of our legal preparedness. Also, I would say that one of the most important aspects and values of national society's work is the ability to identify, access the most vulnerable in different emergencies. But because of the context of the pandemic, this was also quite restricted. So, and we also had the new kind of new vulnerabilities because of the nature of this pandemic. There were often people or older people with pre-existing conditions, immunocompromised people, who were most at risk for severe COVID-19 disease if they were get infected. So we had to also look out for them. Also, then the pandemic also exacerbated existing vulnerabilities. So, and also that just the sheer number of vulnerable people have increased a lot. And National Society were reporting they keep receiving a large number of requests from people for assistance. And it could easily overwhelm the capacities of all humanitarian organizations, not only Red Cross Red Crescent. So in this situation, in this situation, what we can do better for the next time? The National Society should factor these restrictions in their contingency planning for public health emergencies and adjust their approaches of identifying and reaching the most vulnerable during public health emergencies, as we learned. And also that some National Society identified that they should really increase the number of trained people who would respond to these emergencies. And also that one of the lessons learned was that the selection criteria for assistance for vulnerability should be regularly revised, and they should be a very more careful selection. Who are the most vulnerable, to make sure that they're really the most vulnerable are included in the list. However, we can all do these things, but additionally, it is also important to have these pre-agreed agreements or legal facilities that enable for national societies and staff and volunteers to continue accessing the vulnerable people in communities in public health emergencies. Next one, the issue of protection of first responders. This, I would say, was one of the most challenging aspects of the COVID-19 response, because there is risk of infection for staff and volunteers who were mobilized for COVID-19 response, not only for Red Cross Red Crescent, but for all humanitarian organizations, was very high. And the risk was not only for first responders, but also for their families and people who live in the same household with them. So of course, all this created a big high level of anxiety among staff and volunteers. And also there was a increased risk of burnout was very high among them. And also we would have to recognize that there were no very clear procedures in place for those if people get sick while they were on line of duty. National societies try to address these problems from earlier on. They provided with the PPE, protective equipments. They offer training to staff and volunteers. I know that some national society like Kyrgyzstan Red Crescent required that no single staff or volunteer could be mobilized without any training. It was same for many other national societies. They adjusted their service deliveries to restrict their direct contacts with their community members where it was feasible. and they offered mental health and psychosocial support to their staff and volunteers. And also the some national society, like Red Crescent Society of Tajikistan, worked with the Global Solidarity Fund, which was within the IFRC, to offer health insurance to their volunteers. But overall, despite this, all these efforts, the risk remained, and in this pandemic highlighted that one of the key gaps in the legal frameworks in response to public health emergencies by humanitarian organizations. And there should be, we believe there should be a mandatory provision of insurance and compensation for all health workers and volunteers who are exposed to infection while fulfilling their duties. And this is very important. We should not put anyone in harm's way. And as humanitarian organization, we have the duty to protect them. Also, we have to have better contingency planning for next public health emergencies. As in her presentation, Pauline mentioned that there is sometimes not very clear how the public health emergencies responses fit with the with other disasters. Yes, and that was true also in our planning as well, that we had to clarify better and really factor in what we have learned from this response and in our preparedness for next public health emergencies. We have to have better preposition stocks of personal protective equipment, better training for staff and volunteers. We need to have better equipment for our offices and branches, because if situations where they need to work in a remote modality, some of them didn't have really the right type of equipment to continue have a regular communication. And the national societies should, and the government should work together with the national societies and other humanitarian organizations now in helping them to develop better contingency plans for public health emergencies in the future. Also, my next point is, and we should have overall better coordination. I would say the national societies from early on, they made the efforts to coordinate the activities with the overall national responses in their own countries. They were part of the national emergency committees that were specially set up for COVID-19, coordinated closely with the Minister of Health, Minister of Emergencies, and other government authorities. But this helped them to avoid the duplication of the efforts, helped them to better target their communities. But still, overall experience shows that the coordination could have been better, and we have to factor in how to coordinate more effectively in the next public health emergencies. So these are like some of the kind of key highlights that from are relevant for our legal preparedness, and these are the experiences that actually lessons learned that were brought up by 5 national societies when we have had the COVID-19 lessons learned workshops in the past 2 years from our real-time learning evaluations. And of course, there could be many more. And I'm looking forward to hear from our national societies who are present in this call from their specific examples. So that's all from my side. So you can always contact me and Pauline for more information on this one. Thank you. Over to you, Pauline.
Thank you so much, Gerel, for your overview of the lessons learned from the COVID-19 response of Red Cross and Red Crescent national societies in Central Asia. And I note I note that you emphasize the importance of coordination among different actors, the importance of clear roles, particularly of humanitarians during the pandemic, as well as the importance of providing legal facilities and protections for humanitarian volunteers who are helping COVID-19 patients and other non-health impacts of COVID, as well as for ongoing emergencies during COVID-19, because emergencies do not stop even while there is a pandemic. So with that, I would like to introduce our next resource person. His name is Mr. Abdurrahim Muhidov, a regional program coordinator for UNDRR Central Asia. Mr. Abdurrahim Muhidov assumed duties as the United Nations Office for DRR Regional Program Coordinator for Central Asia in November 2019. Before that, he worked in the UN Department of Global Communications, UN Office for Coordination of Humanitarian Affairs, or UNOCHA, and of course, what was previously UNISDR, which is now what we call UNDRR. Mr. Muhidov possesses almost 30 years of experience in the area of sustainable development, DRR, disaster response and preparedness in South Caucasus and Central Asia, expertise in program management, cross-sector coordination, resource mobilization, capacity building, urban resilience, and regional coordination. So without further ado, I would like to give the floor to Mr. Abdurrahim Muhidov.
Thank you, Pauline. With your permission, I will turn into the Russian channel for my presentation.
Please go ahead.
I would like to express gratitude to Pauline Kaspelan for inviting me to participate in today's online workshop. Pauline presented a very important document of guidelines. This document will give us understanding and how to adopt measures in view of threats and PHEs. The document highlighted the importance of cooperation with the partners. Now I ask you to show the presentation on Bangkok principles to facilitate my presentation. Can you see the presentation?
Yes.
Да, спасибо.
Thank you.
Бангкокские принципы реализации аспектов здоровья,
I would like to familiarize all participants with the Bangkok principles of the Sendai Framework Program. You remember there was a situation in 2016. There were several quite large epidemics which were taking place in the African continent, but they did not go beyond the continent of Africa. In 2016, the Asian Ministerial Conference was organized, and immediately after that, an international conference on implementation of health aspects of the Sendai Framework Program on risk reduction of disasters was held. The conference, which was organized in Bangkok, highlighted particular importance to give attention. It was organized by UN, UNDRR. I'm not going to read the whole content of the slides because you will be able to read this presentation in PowerPoint. So then there was an outbreak of Ebola in Western Africa. It was a concern to participants from all over the world.
And considering consequences, the international agencies and biological threats they deal. And at this conference, according with the key principles of Sendai Framework Program, the participants formulated following principles, and they were recommended to those who work in public health, health protection, to in order to reduce disaster risk on biological threats. First of all, systematic integration of the health issues in the strategies and plans on reduction of disaster risk. And you know that Central Asian countries have clearly developed documents, strategies, policies, concepts, and special attention is paid to the health protection issues. And periodically they are developed or updated in order to implement the strategies, and they cover issues, health issues. And in 2016, it was difficult to imagine, to assume that biological threat will cover and reach a big scale and will cover the whole world. And the whole world will have big losses, economic, financial, social nature, and human losses. And then in 2019, the attention of the world community was focused to do this job to prevent losses in public health at the strategic political policy program level. And there are some laws which were targeted issues of health protection and to prevent losses caused by biological threat. And the second principle is to extend cooperation between the health facilities and other relevant stakeholders to build capacity of the countries in areas of disaster risk management. It means not only the Ministry of Health should be responsible and work in this direction, but also other stakeholders, local authorities, national authorities, local partners, and to get support from international partners and development partners, and to be guided by the international health rules. And also very interesting to create sustainable health systems. Unfortunately, the whole world held a pity experience that the health systems were not resilient, not sustainable under crisis situation. And you saw that it was over workload and collapse in many health facilities when they saw that the system, instead of being ready to comprehensive large scale emergency situations, became weaker. And the next principle is related to people oriented policies of the state and private investment in, in disaster risk reduction and including building of health institutions and infrastructure. It is really costly to prepare people and infrastructure because it is expensive. And in spite of these difficulties and economic crisis over the world, nevertheless, we have to draw attention and demand those who have money to build to increase the financing in the field of health system. Another important principle, it is universal knowledge about health protection issues and for population as well as organizations, and to integrate disaster risk reduction issues in programs of health education and training in order to reduce risk, and very important to prevent a small risk be transformed in the large disaster. The fifth principle, to develop a prevention system and early warning system in Central Asian region. There are many sources of potential infection in agriculture sector. The, the the bureau's disposals of the dead bodies of the livestock, and when they're not properly disposed. Also, new diseases, new epidemic, they come from nowhere, and then they are spread in the countries. And so very important to develop more effective and more technological system of a forecast and early warning, and it should be the part of the national strategy and national policy in the field of disaster risk reduction. Cooperation of one country with all structures, it's very important. But using as example COVID-19, this disease came from other continent, from other country, probably, and therefore we have to collaborate, cooperate to share information with all countries, especially for our region, for Central Asian region, because we have a movement of the people between the countries. We have a very good cooperation, and we have trade between the countries, active trade. And I would like to share one successful case the countries of Central Asia reached recently. The regional strategy between the countries was developed in terms of disaster risk reduction. And this strategy was adopted in Tashkent in the 2021, and between four countries of Central Asia. And this work is going on, and implementation of the strategy is supported by the Center of Emergency Situation and Disaster Risk Reduction located in Almaty. And it was established by two countries, the center, by Kazakhstan and Kyrgyzstan. And the regional strategy and roadmap, they also share information and share new technologies and share information in order to reduce disaster risk at all levels, and it relates to all disasters and hazard things. The seventh principle of Bangkok Conference to arrange the further policy, both local and national policies, and And there are problems between the local plans and national plans, policies and strategies, and regulation basis, legislation base requires update and to harmonize between the national level documents and local. First of all, rights and the duties, responsibilities of local authorities, budget, financial aspects, training of the staff at the level, appropriate level, and so on. These are 7 principles, and thank you very much. And I refreshed your memory with Bangkok principles, which were adopted in 2016 at the international conference. And all these principles are still relevant, and they will be relevant for a long period in the future because it's a foundation for strengthening, enhancing public health system and to ensure further development of each country and the whole region in general. Thank you for your attention. If you have any questions in the field of DRR, I'm ready to answer. Thank you.
Thank you very much, Abdurrahim, for the presentation on the Bangkok principles and the implementation of health aspects on the Sendai framework. Before I proceed to the next speaker, I just want to remind everyone that we have a question and answer box at the bottom of your screen, and you can use that to post your questions. So you can direct your questions to any of the panelists or to all of them all at the same time. We also have a Q&A question and answer session towards the end of the webinar later. So there will be a chance for participants to raise their hands live or to put your questions on the Q&A box. Okay, so let me now introduce our next speaker. So our next resource person is please let me know if I'm pronouncing it correctly. It's Dr. UC Sana, consultant of WHO Europe Regional Office. So Dr. Sana works for the WHO Europe Office as a consultant focusing on health emergency preparedness, capacity building, and technical assessments. He has been leading the COVID-19 intra and after action reviews and comprehensively contributing to programmatic work on the implementation of the international health regulations. Prior to joining the WHO in late 2020, Dr. Sana worked as a chief specialist at the Finnish Institute for Health and Welfare, leading its operational activities on emergency preparedness and response, as well as global health and international health regulations and general research. Dr. Sana is an epidemiologist and virologist by training and is a graduate from the European Program for Intervention Epidemiology Training. He is an adjunct professor of infectious disease epidemiology at Tampere University in Finland, and his research focuses on vector-borne and vaccine-preventable infections, global health, including the International Health Regulations, or the IHR. So also, I would like to thank him very much for waking up so early for this webinar, as he is now based in Helsinki, Finland. So we really appreciate your presence here, UC. Okay, let me now put you on spotlight. Over to you.
Thank you so much, Pauline, and thanks for inviting me to this important event. Let me just open my presentation so we can get going. Hold on a second.
So while UC is opening his PowerPoint, I would also like to remind everyone that you can use the chat box to introduce yourself and identify your organization. Thank you.
Okay, can you see the slides?
Yes.
Yes, very good. So again, thanks for inviting me to this event, and actually the timing is very good. It's just ahead of the WHO regional committee meeting for Europe taking place next week, as you know. So today I will cover some basics of first of all, of the international health regulations. What is that, and what's the current status of the regulations, and then what's being discussed in different member states committees at the moment, where are we heading, and what is the roadmap ahead. I mean, the topic of legal preparedness is really a hot topic. It's been discussed in many different forums, and actually later today, I'll attend a WHO call where IHR and then national legislation is being discussed, how to better implement the IHR in national legislation. So it's really a hot topic, as said. So let's start with with some important concepts here. It is a complicated landscape when it comes to public health work, global health work, and threats around these areas. So health security does not only depend on the health sector, but on effective multi-sectoral coordination between relevant sectors. And you can see in the figure here, the many sectors, if not all sectors, are relevant in health security preparedness work. And we have to navigate and foster this coordination at many different levels, so global, regional, and community, national level. And one entity doesn't really have all the capacities. But then also capacity is not everything. Capability is capacity and ability. So emergency preparedness is also about having systems in place to mount an effective response. So that's the landscape here. And then if we look at the threat picture over the last years, here's a figure showing a scale of different health emergencies from all hazards 2021 and 2022. So you can see a number of events have been occurring around the world. Now these are mainly infectious disease threats here, but as you all know, of course, you have lots of other emergencies happening around the world. And we do see an increasing risk of outbreaks due to many factors, due to, for example, environmental degradation, rapid urbanization, and increasing international travel. And then at the same time, if you look at the years ahead, increasing climate and geopolitical crises are then affecting this picture, and we have hundreds of millions of people in need of humanitarian assistance at the moment. So we need to widen the scope of focus and interventions to cover the whole range of emergencies that have consequences in health. Okay. So then, what is the IHR, the International Health Regulations? Well, to put it briefly, it's an international legal framework, convention, which helps countries work together to prevent, protect against, control and respond to an international spread of disease. But at the same time, avoiding unnecessary interference with international traffic and trade. So it has this balance embedded in the regulations. It's binding upon all WHO member states, regardless of in-country ratification. But at the same time, it doesn't really have any direct sanctions if countries are not ratifying the IHR in their laws. It covers biological infectious threats, chemical, radionuclear as well. We're talking about zoonoses, so zoonotic infections, food safety issues, emerging, re-emerging infections, vector-borne, vaccine-preventable diseases, anything related to public health emergencies and environment as well. And it's always useful to look at the past, so go back a bit in time to understand how the present looks like, right? So here's a quick summary of the IHR developments over the last decades. Although there were some global regulations in place even before these decades I'm showing here. But as you can see, many different events over the years then shaped the regulations. So we had different events, cholera epidemics, SARS, avian influenza, H5N1 and others, which then led to changes in regulations or some revisions of the regulations. And the most recent version of the IHR was adopted in 2007. And now once again, after the recent emergencies, we're looking at the potential revisions. So when you have some regulations implemented, it is essential to have some monitoring and evaluation systems in place to study what gaps remain, what actions are implemented, or if actions are implemented, and if health security preparedness has actually improved in countries in concrete terms. So how is IHR then monitored? So basically, we have two different dimensions here. We have the quantitative and the qualitative side. When it comes to the quantitative side, we have the so-called SPAR, State Party Annual Reporting, which consists of a number of indicators for the different IHR technical capacities needed to assess, to detect, assess, and notify, and report and respond to different public health risks and acute events of domestic or international concern. So this is an annual reporting, and it is a mandatory tool, although it's not always all countries are responding to this every year. Then there's the voluntary external evaluation. It is a voluntary tool, but it is quite widely implemented nevertheless. This also includes an external assessment. So actually a team consisting of member state experts and some WHO experts, some other UN agencies as well. They come in for a week in a country, they talk to country experts, they review documents, they perform site visits, and then come up with some scores and priority actions. So these are the quantitative tools. And then we have the qualitative tools. We have simulation exercises, after action and intra-action reviews, which then try to assess the functionality. So how should it work? Does it work? And how can we improve? And finally, all these should lead to the so-called National Action Plan for Health Security, which is a comprehensive, multi-sectoral, multi-year plan to coordinate evidence-based priority actions of various sectors for the purpose of strengthening health emergency preparedness. It's using principles of all hazard and One Health concepts. It's basically operationalizing the different recommendations, for example, from the JE and other assessments, and should have a robust national accountability mechanisms for ensuring actions. The COVID-19 pandemic exposed a number of gaps and highlighted some areas in need of strengthening in these tools, as well as put on the spotlight on essential capacities for countries to respond to large epidemics. So following these recommendations, following the lessons learned, COVID-19 and also other emergencies, the SPAR, the annual tool, was revised recently and now includes 15 capacities and 35 indicators. I'm not going to go into details of all this. I just want to highlight that when we're talking about the legal preparedness here, there used to be a area called legislation and financing, and now it's been divided into two capacities. So we have one on policy, legislation, and normative instruments. So really highlighting the importance of this legal preparedness. The same then happened for the JEE tool. Again, it was revised based on many lessons learned, but here too, the area on legal instruments was implemented or was introduced in the tool, again to highlight the importance of this topic. So these were now the basics of the IHR and how it's monitored and what are the routine processes around that. Now let's talk about the big picture and the landscape of different ongoing processes when it comes to strengthening the pandemic preparedness and response, and in general preparedness response to health emergencies. Many abbreviations here, and I think we're all a bit lost at times, of course, but we're talking about rather complicated topics. with many technical and political dimensions. So we have the World Health Assembly, obviously, which is the decision-making body of the WHO. And there's the executive board composed of technically qualified members elected for 3 years terms and so on. But then based on the COVID-19 crisis, the crisis highlighted the need to strengthen governance function of the executive board. And then because of this, last year it was proposed that this so-called standing committee of the executive board should be established, and this board could then provide rapid response to pandemic that's been lacking at the level of organization governing bodies for some time. So this SCPPR was then established, and although the exact terms of reference is still work in progress. And then a number of different working groups have been established. Working group on sustainable financing, working group on strengthening WHO preparedness and response to health emergencies, and then the INB, topic of today as well, the intergovernmental negotiating body. So this I will talk about that more in the next few slides, but this is an important element in terms of thinking ahead and how to better respond to emergencies and what are the legal mandates behind different required capacities. And then also the IHR review process is ongoing as well. So there's a working group on looking at that, what should be revised in the IHR. And all these what I talked about, different committees, different processes, it's never a straight road. Like it is a long road. It has twists and turns, as ups and downs, and the so-called mountain slide, we call it, kind of illustrates the process, where we are, where we're going, what are the different stops on the way. So as I said, next week there's this regional committee for Europe happening in Tel Aviv in Israel, and before this, a number of events, a number of meetings have been occurring, considering or concerning all these different processes. And then the road continues, and it will still take a couple of years before we're actually reaching the final destination. So this is just a summary of the ongoing processes. And when it comes to the INB, the Intergovernment Negotiating Body, last year, through a decision at the World Health Assembly, this was established in accordance with different rules of procedures, and the body was established. And the body was established in order to draft and negotiate a WHO convention, agreement, or any other international instrument on pandemic prevention, preparedness, and response. So this is the main idea. And the first meeting was held in February this year. And in the first meeting, they agreed on the method of work. They elected the chair. There's a chair from the Netherlands and South Africa as co-chairs. And then there are a number of vice chairs from Brazil, Egypt, Thailand, and Japan for now. And 6 officers, each representing 6 WHO regions. And this will then comprise the INB Bureau, so to speak. And at the first meeting, they agreed again on the method of work based on 5 principles: inclusiveness, transparency, efficiency, member-state leadership, and consensus. So here they decided on the starting point, and then the process continued. And recently, there was another meeting in July, and then based on this meeting, I'm just showing a couple of key points, what was achieved. So the Bureau, the INB, they looked at the founding documents and decided that it's a good basis for facilitating discussions. And they agreed to process for intersessional work with the view of presenting a so-called conceptual zero draft for the consideration of the INB3 in December 2020. And they agreed that this instrument should be legal binding and contain both legal binding as well as non-legal binding elements. And they also identified that specifically Article 19 of the WHO Constitution is the comprehensive provision under which the instrument should be adopted, and also possibly Article 21. So it's very technical here, and of course it's a very slow process. It has to consider a number of different viewpoints from different member states and different stakeholders, but it's going on, and this is these are the first steps of the process. And here's a plan for the future, a timeline, what's happening next. So now during the autumn, there will be rounds of public hearings, regional consultations, and then the INB will develop this zero draft in November, December, and then they will have a third meeting in the early December this year. Then at the same time, I talked about IHR, and I talked about the IHR revisions. There's a working group on amendments of the international health regulations. So just to emphasize here that there are two concurrent processes ongoing. So we have the INB work to develop the pandemic treaty or some kind of a legal instrument, and then we have the work to revise the IHR based on proposed amendments. And this really highlights the position of many state parties, which clearly expressed last year that the IHR is still in the heart of the emergency preparedness, and the basic principles are valid. But it needs revision for sure. But the pandemic treaty should not replace IHR. It should complement it. So these are two parallel processes ongoing at the same time. And then just to mention a few points from WHO Euro side when it comes to activities for future. There's been an action plan before for the period of 18 and 23 to improve public health preparedness in this region, but now it's approaching its 5-year. At the end, it's approaching the end of its 5-year lifespan, and now based on COVID and other emergencies, there's need for new action plan, and this is called the Preparedness 2.0. And this will be developed based on member state consultations by creating a technical advisory group, establishment of different expert commissions, and really considering all the lessons learned from recent emergencies. And I think we will still learn a lot when it comes to COVID in the future months and future years. And then WHO Europe is proposing this new strategy to strengthen health emergency preparedness, response, and resilience in the WHO European region. And now in the RC, the regional committee next week, this Preparedness 2.0 paper is presented, and then it will be discussed, and then the process will move on. And it all links to the bigger picture. So the European program of work, which then also links to the global program of work. So we're talking about different core priorities. I talked about health emergencies now, but we also have, of course, the universal health coverage, and then health and well-being in general. So all these together form the outlook for the future, and also have principles for the programmatic and budgetary accountability of Europe, WHO Europe. And then on the global side, the DG of the WHO has this proposal on strengthening health emergency preparedness and response and resilience, including this 10-point proposal under the kind of umbrella of the new overarching global instrument, which is being developed. So I'm not going to go into details here, but these proposals are linked to all these other processes I've been talking about, and they are and the proposals are grouped by 3 main pillars: governance, systems, and financing, and based on 3 different principles: equity, inclusivity, and coherence. So a lot is happening, and as I said, it's a long road ahead. but it is important to hear from different stakeholders at this point, how in order to shape the process that it actually, in concrete terms, will strengthen the preparedness response capacities. So thank you very much. Over from my side, I have to take any questions later on. Over to you, Pauline.
Thank you so much, Dr. Yusisani, for your very interesting presentation. Just to link that with the presentation presented by Mr. Abdurrahim Muidov, where he spoke about the DRR strategy for Central Asia and the broader Bangkok principles on the health aspects of the implementation of the health aspects of the Sendai framework, where he emphasized that one of the principles there is to integrate disaster risk management into health, and also health risks into disaster risk management. And then now you have given us a very good presentation about the changes that are going on with two main instruments that guide public health emergencies globally: the international health regulations, and of course now this proposed pandemic treaty. So we can see that a lot has been going on in terms of revising these frameworks, both at the international and national level, to reflect the lessons that we have learned in COVID-19 and the need for coherence, as well as the importance of legal preparedness. As you mentioned, it is now part of the, it is now being proposed as part of the capacities, if I understand correctly, the new, broadened capacities that will be required of countries to implement the international health regulations in order to better manage public health emergencies globally. So thank you very much. We will have a room for question and answer, live Q&A later towards the end of the webinar. So I hope that you can all stay. However, in case there are others who have questions that they just want to type in, you can use the question and answer box at the bottom of your screen. Right now, we are now moving on to the second part of our launch of the IFRC Guidance on Law and Public Health Emergency Preparedness and Response. We are now entering the moderated question and answer session, and I would like to introduce first our moderator for today. So let me just share my screen. I would like to introduce to all of you my colleague, Mr. Nurlan Jamaliev, Program Manager for IFRC Central Asia. Nurlan has over 10 years of experience in country and regional development and relief intervention, focusing on areas of conflict prevention, good governance, community resilience building, and economic development, funded by various development agencies. He has also served as the operation leader in one of the international financial institutions and led nearly 10 investment projects in sectors such as water and wastewater management, urban irrigation, solid waste, and district heating. Nurlan has worked with national partners, including the Office of the President and the Prime Minister Office, ministers, members of parliament, as well as local and international non-state actors and consultants, as part of building and delivering inclusive and sustainable development interventions. So I would like now to welcome my colleague Nurlan to please moderate the second part of the webinar. Sorry, Nurlan, can you please check whether your mic is connected, if your audio is connected? I cannot hear you from English channel. Are you on the Russian channel?
Russian.
Okay, thank you.
Okay, thank you very much, Pauline. Just I'll be switching to Russian. So, yeah. Добрый день, коллеги.
Good morning, dear colleagues. Thank you for your time, for your interest to this topic, to a constructive dialogue platform meeting. And let me summarize quickly what we heard in the previous component. The second part, we suppose we will have a more interactive part. We will have answers and questions, and other participants can also be involved and ask questions. I will summarize the previous part.
In general, as we all know, COVID was a big problem for many countries, not only internationally, but domestically inside the countries. It was a problem for the whole globe, for the whole world. In general, COVID became a test for human qualities, for systemic structures, coordination mechanisms, and for movement of goods, resources. In general, COVID was an unprecedented phenomena, which was a test for us as to what needs to be done and what should not be done, what should be better formulated. And now we understand that it is necessary to work on lessons learned, on our mistakes, and to analyze our achievements. COVID was like an impetus to improve preparedness, especially on PHE. COVID emphasized the importance of coordination domestically between the national structures and communities and the ministries, and also it emphasized the importance of coordination between different countries. Even the slightest changes in one link, in one chain, was providing an impact on the whole regions and globally. Also, COVID kind of verified or tested preparedness of countries on prevention and on preparedness to such situations. If I recollect right, maybe there were similar pandemics in the previous time. COVID was a challenge to the global system. And in this light, there were several aspects about which I would like to say a few words. I would like to mention which gaps were available. If I speak briefly, there were such main aspects and difficulties as access to vaccines and diagnostics for treatment. Also, assessment of preparedness of PHEs on the level of countries. And number 4, restriction on movement of goods and personnel during pandemic time. In general, COVID was like a cold shower for all systems, for all countries, for all people. As you know, as Jussi, our colleague, mentioned, he already told briefly, there is ongoing work on preparedness, on increasing preparedness to such situations in the future. So with your permission, I will start talking on the second part, on the part which should be moderated and discussed. The first issue which I would like to ask, my question is to Talant Mamitov, head of department on health. Talant Baike, From your point of view, how coordination mechanisms of Kyrgyzstan on disaster management supported the measures on response to pandemic in Kyrgyzstan and across Kyrgyzstan? Talant Bake, I would like to give the floor to you. If you need, I can repeat my question to you. Yes, please repeat the question. In view of the pandemic, COVID-19, how coordination mechanisms domestically inside Kyrgyzstan helped to respond to the pandemic of COVID-19? Speak about coordinating mechanisms inside the country, in Kyrgyzstan. I'm happy to welcome all participants of today's online event. I would like to say that the Kyrgyz Republic was the only country when the seminar, when in March, first imported cases were registered in our country. In order to prevent dissemination and liquidation of consequences of social nature, we prepared such decisions of the government and got them approved. In 2020, in January, a decision about establishing the country Republican headquarter office to work on prevention of spread of COVID virus. The ministry, there was an order of the Ministry of Emergency was issued to establish an operational headquarter hub or center. In March of 2020, the Prime Minister issued an order to establish a headquarter office to prevent dissemination of COVID infection across the Republic. And on the 4th of February 2020, mode of high level of preparedness was announced across the country, and it was introduced on the 22nd of March 2020. Mode of emergency situation was announced. At the same time, a plan of operational actions was approved, and which explained how to function in conditions of COVID. Also, we prepared a slide and we would like to demonstrate it to you on this topic. IT assistant is helping to demonstrate this slide. I hope that you can see this slide. So this is an order of Prime Minister of the Kyrgyz Republic. All they were adopted on the governmental level. Now, on the right-hand side is another order on prevention of dissemination of COVID virus infection. In accordance with this decision, it was against the dissemination of coronavirus infection and liquidation of its consequences. The ministry was to take daily and to organize 24 hours of points, preparation of beds in such facilities. Such health facilities were established, and they worked even at night. Staff from the Ministry of Emergency Situation were invited and engaged at the so-called block posts. They worked in emergency hospitals, especially established in different locations. So they were responsible for placement of people in observation facilities. They were also responsible for transportation and delivery of humanitarian assistance. They devoted a lot of efforts and invited and engaged many structural divisions of the ministry to such works. In order to implement the above mentioned order, and in order to prevent dissemination of this viral infection, they carried out everyday disinfection works in the streets, on the roads, and in public places with high risk of spreading infection. In total, they disinfected across the whole country more than 12.5 million square meters domestically inside the country, 53 million square meters of outer walls of buildings, and millions of kilometers of highways and roads. They were using chlorine for disinfection. They were using it in powder and then making it liquid form. They made more than 3,000 trips of machinery. And in November 2020, these works were curtailed and stopped. In addition to this, with the efforts of local authorities, they prepared 15,180 beds in health facilities. Upon decision of operational headquarters, they established a checkpoint. They established I cannot hear them. Several buildings like observation rooms, cemetery with many beds for those who arrived through the airport, Manas. So it was established not far from the airport, Manas, and the number of beds was increased to 1,302 beds, person beds. According to the approved algorithm of activities, the above observation facility cemetery was re-equipped additionally to make it a hospitalization facility. It helped very much to combat dissemination of COVID infection across the Republic. And of course, we organized allocation of money for re-equipment of already existing buildings in the territory of the airport Manas. The Ministry of Emergency Situations, together with the State Agency on Architecture and Construction, developed a project, a design for reprofiling and refurbishment of temporary sanitary and quarantine facilities. Out of 13 buildings, in 5 for 600 person beds, they equipped everything for hospitalization of sick people. In addition, specialists of Service 112 carry out work on providing consultations and counseling in cases of possible infection. From March of 2020, 51,000 telephone calls were received by this telephone service 112, linked or relating to coronavirus infection. In order to provide humanitarian assistance to vulnerable population and in social sphere, automobile transport delivered 9,300 tons of flour and 314 tons of sugar allocated from the fund for material reserves of the Kyrgyz Republic. There was also donations, assistance from different countries internationally, and this assistance was in the form of medicines and other forms, and it was delivered to many districts and regions of the country. The Ministry of Emergency Situations supplied medicines, food products, construction materials, and hygienic items to China, to Republic Uzbekistan, Tajikistan, and to ethnic Kyrgyz who live in small and larger Pamir. I also would like to report to you that the objective of curtailing and stopping dissemination of COVID infection, there is an ongoing vaccination of population in the Kyrgyz Republic. In 2022, we have the following situation. In total, 205,835 people, approximately 3% of total population were registered as those who fell sick. At the present time, 6,438 people are sick. Deaths were 2,239 people, comprising about 1.5% of the total number of those who got infected. More than 4,000 staff people of Ministry of Emergency were vaccinated. From the beginning of 2022, in total, 28,000 were registered of infecting. Of them, 90.5% were laboratory confirmed. Thank you for your attention. And if you have questions, please ask them. We are ready to answer. Thank you very much, Talant Bayke, for your presentation, for your most recent data. We can see Chirgaldek Ukashev. Dear colleagues from Kyrgyzstan, the question was, we were asking you how the mechanisms worked. I told you that the Republican headquarter office was established. It included all bodies of governance, all bodies of management in our country, all ministries and agencies sent their or delegated their representatives. Ministries and agencies who are obliged to provide assistance in order to prevent and curtail spread of coronavirus infection. Such as sanitary and epidemiological service was involved and engaged. The Ministry of Transportation, the Ministry of Environment, all governance and managerial entities such as ministries relating to curtailing spread were engaged, and they really participated. They in full carried out work, beginning with the state borders of the country. Each region, each district, and smaller administrative entities, heads of these entities on all levels participated. And at the present time, we also carried out awareness raising work, and we supported the vaccination. I would like to add 2 words. I also formerly worked in the Ministry of Emergency Situations in Kyrgyzstan. In Kyrgyzstan, legal frameworks for responding to such PHE situations, they have been developed, and they work on a very rather good level. The only question is about execution. Regulations are really very good. The system for liquidation and prevention of emergency situations has been established. Laws and regulations are available, including the Ministry of Healthcare, different medical services. The second issue about coordinating mechanisms, I would like to report briefly. In Kyrgyzstan and in Tajikistan were established due to our partners, development partners, very good systems for response, coordinating system for responding to emergency situations. For instance, in Kyrgyzstan, it was established in 2008. It was a coordinating group. The country mechanism on one part, governmental agencies, on the other part, development partners, UN agencies, donor agencies, and other international organizations. And this system, to a great extent, and my colleagues from the Ministry of Emergency will confirm my words, this coordination worked really very well. And additionally, Kyrgyzstan used assistance of development partners, and Kyrgyzstan was able to resolve many objectives and tasks for combating COVID-19. Thank you very much, Jirgalbek. Thank you very much, Talant Bayke. Thank you very much, Jirgalbek Bayke. At the end of our event, there will be time allocated for questions and answers. But if you have very important questions to ask now, you are welcome. But I just wanted to tell you that at the end of the session, there will be questions and answers session. We expected participation of representatives from the Ministry of Health from Tajikistan. However, because of some technical aspects of probably communication, the representative was not able to participate. We expected that within the framework of his presentation, we planned to discuss perspectives on healthcare and on legal preparedness of Tajikistan on PHEs. So with your permission, we continue our work on the agenda, and I give the floor to Dilarom Saidovna, Deputy of General Secretary of Red Cross and Red Crescent Society. Dilarom Saidovna, I thank you very much for your participation. Dilarom Saidovna is Deputy Secretary General, Red Cross and Society of Tajikistan. Please tell about activities in the time of epidemic COVID-19 and what you did in regard of vulnerable populations in your country. Good afternoon, dear participants, dear colleagues, and dear partners. I welcome you all, and I express big gratitude for opportunity to present experience of the National Society of Tajikistan on response to COVID-19. We started in March. We began members of the National Group for the Development of the National Plan for Response to the Epidemic. We determined our role, and it was mostly in communication policy on the level of communities. And of course, we identified and formulated our role, focused on combating the pandemic. The national office in Tajikistan established 69 branches across the whole country, and it mobilized 2,100 volunteers from across the whole country. We covered by our activities 1.3 million people by information on prevention of COVID-19, including 500,000 of school children. We covered geographically and socially isolated communities and people from risk groups who are in remote areas. There was technical assistance, those who worked on the front line. In spite of the outbreak, we continued our work, and it was a very important work, such as fighting tuberculosis. 53 MDR-TB received food products, packages. We carried out controlled or monitored cure treatment and provided psychosocial counseling and support. We supported 16 quarantine zones as members of the National Headquarter Office on COVID-19 and Platform React. We discussed publicly our experience with the public at large. And these centers were as facilitators for training volunteers for disseminating information about COVID. And of course, trainings were provided. There were such partners who helped in development of informational materials and posters. UN Women, USAID, Etica, National GIZ, Chinese Red Cross, and the foundation of King Salman. Many pieces of work required individual explanation, personal explanation. It was necessary to make sure that only verified and correct, right information was provided to the population. We worked, we trained about how to work with people with chronic diseases, TB, HIV, in special risk groups, and people without going out of the house, they were able to get answers to the question. People with TB and HIV expected to get more support. And again, this interim assessment demonstrated that especially it was the most vulnerable group, especially in relation of MDR-TB. COVID-19 enhanced domestic violence based on gender, and the burden on women increased. Labor, household labor in the family was mostly the duty and task of women.
Hello, sorry, we lost the English audio. Can I ask the interpreters to please?
Can you hear me now?
Yes, I can hear you now. Apologies
Yes.
to Ms. Dilarom. Maybe you can repeat again the last few sentences. Thank you.
Диляром Саидовна, Полин говорит, что
gender-based violence increased burden on women, and household labor was mostly the duty of women. Labor migration increased, unemployment and isolation increased violence on the level of families, on the level of households. We were referring such women to crisis centers. There were 6 crisis centers for this purpose, and they were implementing their duty, their work. However, children were left without attention because adults were panicking. However, the children were the best listeners. What were the difficulties in our work? it was quite difficult to provide counseling inside the families, and we were observing burning out effect among our volunteers and among other staff. Many of them got sick COVID and then came back to work. And we were to reimburse some costs to those people who got sick from our volunteers and staff. Insufficiency of digital information, lack of insurance of volunteers. There was some problem with supporting of continuity of the main services, the balance of COVID and non-COVID activities. It was also a challenge to listen to people who were speaking from communities and in communities. It was a challenge to invest into local organizations to build their capacity. It was an important aspect. It was quite difficult, and this aspect should be improved. Assessment in the communities. It is necessary to carry out research work in communities, which would lead to meeting the needs according to their needs. Also, we learned that it was necessary to exercise flexibility in the process of respond to PHE. It was necessary to provide support in mobilization of resources and increase our support in ensuring volunteers and personnel. Quick changes in the trends, in dynamic and climate change aspects kind of caused enhanced threats of infectious diseases. At the same time, it was necessary to pay attention to reduce risk of natural disasters. Systemic approach will allow to eradicate duplication and provide the assistance to communities, the assistance which is in demand, which is needed based on their needs. And of course, this can be achieved through strong coordination and cooperation. Quickly changing environment produces new challenges and circumstances which may create strong stress for the system of risk governance. At the same time, I agree with previous presenters that it is necessary to enhance, to make stronger legal frameworks. It is available, but implementation is important. It is necessary to focus more on implementation mechanisms of the pieces of legislation. She means regulations should be strengthened. And it is necessary to meet the needs of society in the time of pandemic. Thank you for your attention, and if there are questions, I am prepared to answer. Thank you very much, Dilaron Saidovna. Since our time is limited, let us move to the following paragraph on our agenda, and we will give the floor to the next presenter. And then at the end will be 10 to 15 minutes of questions and answers session. And now I would like to give the floor to Mr. Jergalbek Ukashev, who is the director of CESDRR. The center is based in the city of Almaty, Kazakhstan. Mr. Jergalbek, how is legal preparedness to emergency situations, to PHEs, will help to build and strengthen regional cooperation in Central Asia on preparedness to such emergency situations as COVID-19? Thank you very much, Mr. moderator. Good afternoon, ladies and gentlemen. I hope you can hear me well. I will be speaking slowly and I will try to speak louder. As a priority, what I would like to say first. Today, on our small blue planet of Earth, there are about 8 billion of people. Just a few decades ago, there were 2.5 billion people. If you carry out a survey, you will get the answers that 2020 and 2021, and you know about that. The first global problem was COVID, or priority global problem was COVID-19. Of course, there were issues of climate change, but COVID-19 was the most serious problem because it made an impact on 600 million people. We lost 6.5 million people, irrecoverable losses in terms of human people. Therefore, this topic, this theme is extremely important today. And let me, on behalf of all participants, and there are around 30 people discussing today, I would like to express those who organized this event, because you are raising the topic, which is extremely important nowadays. So, just about our center. This center, even the name of the center tells about our mission in the region. We are operating in the region of Central Asia. We know this region, we know the mentality of this region, the mentality of people from this region. We speak about strengthening and enhancing cooperation of different countries in the region of Central Asia, and organizing response, preparedness and response to PHEs. Today, I can say that there are certain successes, and it was a really difficult way to such achievements and to such success. Dear colleagues, between all countries of Central Asia and in all countries, there are bilateral and multilateral intergovernmental relations on prevention and liquidation of PHEs. And there are, so in order to develop a mechanism for implementation, to implement intergovernmental agreements, and in order to develop instruments or mechanisms during all years, beginning with 2011, it took a lot of time and many years. And beginning with 2018, we work based on the regional forum, which is a meeting of heads of ministries of emergencies from Central Asian countries. This is a standing platform, a continuously operating platform. The importance of this platform is very high. When there were meetings, we were only adopting declarations and resolutions, final documents, and we were saying to enhance, to focus on, to highlight or emphasize the importance of, but we produced, we made very positive steps. We convened an annual meeting of heads of ministries of emergency situations, and they discuss all topics relating to emergency situations, climate, and on COVID, and they make decisions which are recorded in the protocols, in the minutes, mandatory for execution. And we always can say, on the basis of what? Last year, we adopted with support of international partners, including our partner from UNDRR, we developed a roadmap until 2030, and we will be implementing it stage by stage. Now we work against COVID. We succeeded to some extent. Dear colleagues, you know that in all documents, it reads as follows, that as a priority, every country represented by governments, parliaments, represented by different authorized governmental agencies, they bear the highest responsibility, the most important responsibility for reducing the risk of PHEs and other disasters. So on the basis of what? Why this question is so important today? Any actions, any activities of the government and of all of us should be based on legal frameworks and on regulations, orders, instructions, and plans. In general, I would like to say that in countries of Central Asia, if we look at the documents, at the papers, and official data, we can say, yes, many legal laws, law on authorized governmental entities and plans are available and are in place. But I would like to focus your attention, colleagues from governmental structures. You are the servants of the people, and you are responsible. You bear the responsibility. And the question is how all these laws and regulations implemented in 2020 and in 2021 and 2022. I'm not going to criticize today or give positive aspects. How many facilities were opened, how many were closed. It is not the most important. The issue is that today it is necessary to call on all of us. We should ask what we have not done. What were our weaknesses, gaps? What were our weak sides? All this should be analyzed and put into a system, systematized. Why? Because in the future, we need to enhance our preparedness, not only legal preparedness, but our preparedness in all other regards. I do not see this work in countries of Central Asia. Maybe I'm overcritical, but the public does not know about it. People do not know about it today. We speak about big figures of dropping GDP, about poverty, about material losses. So what is about regional aspects? I personally visited 4 countries of Central Asia during COVID time in 2020 and in 2021. What we were doing there during this time, we were publishing evidence-based information on COVID, not only how many people fell sick and how many died. We were explaining and describing how the borders and checkpoints were operating if planes are flying. This information was published on a daily basis for all stakeholders. However, feedback was very minor, very small. Then we moved to carrying out consultative regional meetings. We held only 3 meetings and curtailed them because there was no feedback. This is why I would like to say now that a big drawback to our center, that we were not able to consolidate our efforts. We were trying to get requests from different countries. For instance, such requests, how many migrants got stuck on the checkpoint, where there is shortage of medicines. This is why, in this regard, quite recently, there was support from OSCE. With the support of OSCE, we designed we wrote a report about impact of COVID-19 on enhancing sustainability in Central Asia in terms of COVID. There were national experts and international experts, and we placed this document on website. And now I would like to wrap up my presentation. The guideline or guidance which was developed, it was developed by really very strong experts. The administration, the leaders of IFRC, they provided guidance for PHEs, how to organize response and preparedness. All this should be presented and to the governments, to decision makers, to the ministries of emergency situations and to the Ministry of Health. Why? So that they take into account. And finally, these ministries should take into account that in spite of laws and regulation, I think that there is a big need to introduce amendments and additions both in regulations and in readiness plans. For instance, some stocks of medicines or food or equipment should be organized, etc., etc. A lot can be written and said about it. Dear colleagues, I would like to add, and maybe you will help me, maybe it makes sense not only to have a committee of heads of ministries of emergency situations. I have not seen about establishing of such a council of ministers of health. They meet only sporadically or occasionally. I think that it is necessary to establish a council for meeting of heads of ministers of health for our region. I can speak more on this topic, but my speaking time is limited. I call on all of you that all those who participate today in the meeting, you should do your business, your duty on your level, and you should inform people who are making decisions. We have very good documents, very good methodologies, but they remain on paper. There is no sustainability and there is no implementation. This is why I'm saying, dear colleagues, we are doing very useful work, but we need to ensure efficiency and outputs and the outcomes. We need to ensure results. I express gratitude to IFRC, and my colleagues will agree with me. Our National Red Crescent Society is a forward advanced team which helps in small and larger emergencies. Please support their operations because they are legitimate in all countries. They have operational groups from our Ministry of Emergencies. They always are on the front line. Dear colleagues, we in the center take into account our drawbacks. In October, we will have a meeting of heads of the Ministries of Emergency Situations in Dushanbe. One of the most important topics will be the issue of coordination between ministries of emergencies on PHEs, as well as we will speak on the challenges in relation to climate change. I would recommend those who organize, we should not talk and forget. We should write a protocol, the minutes or document with some conclusions as to what needs to be done. we should not only wrap up and finish. We need to produce a final document, and which will help us to work as guidelines for the future. Dear colleagues, I hope that humankind, as well as countries of Central Asia, had lessons learned from the COVID-19 pandemic. And I hope very much that in the future, we will enhance our legal framework and laws and regulations. And we will have to enhance coordinating mechanisms. I wish you to be in good health, and I wish you all success. You know what is positive in the countries of Central Asia in comparison, for instance, per 100,000 or per 1 million, our average indicators are higher or better than international indicators. And Central Asian region coped with the tasks on fighting COVID-19 in a good way. Thank you very much, Geralbek Bukashev, Geralbek Bayke. It was very informative, and thank you very much for your excellent wrap-up. So, dear participants, with your permission, in order to continue the topic of Mr. Geralbek, I have a question to all participants. You probably have looked through and brushed up the guideline. The guidance on preparedness for PHEs. Also, the WHO carries out certain work, and we are today here also to discuss a pandemic treaty. Agreement or treaty, how to combat pandemics. All what you propose today, all this will be polished, and then it will be promoted to the global level during the discussion of the pandemic treaty, when it will be discussed. So if you have questions in general or recommendations on the guidance, we have about 10 minutes. And if you have questions, we can start our questions and answers session. So in principle, I thank all participants very much. This meeting was recorded. We will write the minutes, or some people call it protocol. It will be disseminated to our colleagues from WHO on integrating all this into the documents on the treaty. The second part, with your permission, I declare it closed. One more person wants to speak. We give the floor to Geralbek. I want to say on behalf of our center that this guidance, we are going to place it in our website. We work in close cooperation with governmental entities. Maybe we will write a special standalone letter in the working manner from our Ministry of Emergencies. It will be a letter to all Central Asian countries to pay attention on these recommendations. Dear colleagues, this will be a one-page final document, and we ask our participants So to be discussed by this and that time, and it will entail some follow-up steps. Of course, this problem requires specific actions. I'm saying that we are to analyze the lessons learned, what we did well and what we have not done. There should be criminal responsibility introduced, or because there are some awful cases when somebody was to make a decision and it was not done, and the consequences were severe. I wish you all success in your work. Mr. Jergalbek, thank you very much for your guidance, for your recommendations. In general, I would like to wrap up. COVID was a test on the global level and on the country level and on the level between the countries. There were no long-term challenges of that type before. And this COVID pandemic will allow us to make conclusions or lessons learned on the global and country levels. Will allow us to highlight our drawbacks and weaknesses and some aspects which should be enhanced. For instance, such drawbacks and weaknesses in the legal framework. So in some countries, legal frameworks should be enhanced, as well as mechanisms for implementation in the form of regulations, both on the country level and on the regional level. But it was highlighted that there are some challenges or questions about movement, customs, logistics, coordination, and vaccines. But in general, if all entity and every human being, every ministry, every country, and every coordinating mechanism, structure or center makes conclusions, it will lead us to a dialogue as to what needs to be improved and in the future, and we will make good steps forward. And one of such aspects is what WHO is doing at that present time. It is a pandemic treaty. All our discussions will be handed over to WHO. Jergalbek, we ask you to write a small memorandum of understanding or memorandum of cooperation based on the results of today's Zoom meeting. And we will inform you all about the status of this memorandum. So with your permission, I declare this session closed. And now I give the floor to Pauline. Maybe Pauline has questions. Pauline, do you have questions? We would like to give you the floor now.
Thank you, Nurlan, for moderating our the second part of our webinar. And I would really like to thank our panelists. So CES here, our director, Mr. Jergalbek Upashiv, our panelists from the Tajikistan Red Crescent Society, the Deputy Secretary General, Diloro Mirova. Thank you also for the panelists from Ministry of Emergency Situations of Kyrgyzstan, Major Talant Namatov, and I hope we didn't get a chance to hear from the Ministry of Health of Tajikistan, but I hope that we will get a chance to get some comments from them, whether in writing after this online launch. I would also like to thank our resource persons who set the tone for the discussion of the day. Of course, our speaker, from our own organization, Dr. Oingerel Anga, IFRC Health and Care Manager for Central Asia. Mr. Abdurrahim Muhidov, he has already left, but I would still like to express our thanks to him. He is the UNDRR Central Asia Regional Program Coordinator, who gave us also the disaster risk reduction aspect of this entire discussion about public health emergencies, because the work that we did in this guidance on law and public health emergencies was really born out of the conclusion that it is really interrelated. Public health emergencies and broader disaster risk management mechanisms have been utilized by different countries worldwide, and we have seen that kind of coordination in Kyrgyzstan itself, where based on the presentation of the Ministry of Emergency Situations in Kyrgyzstan, they were also helping together with the Ministry of Health and other ministries in terms of the day-to-day operationalization of COVID-19 response, including the setting up of hospital beds, as well as providing assistance to quarantine, providing quarantine facilities and managing quarantine facilities for those who are arriving abroad. So, of course, last but not the least, our speaker from WHO Europe office, Dr. Yusi Sane, who has given us a really very concrete, a very clear, short but very clear process, overview of the process of what is going on in terms of the discussions on this proposed pandemic treaty, as well as the international health regulations review. So just to sum up everything, what we wanted to do here is to show you that there is this available guidance, which can be used by governments and those who are supporting policymakers in reviewing existing legislation, or as mentioned, of course, by Mr. Okashev, in reviewing the status of implementation of these existing laws and regulations surrounding public health emergencies. We hope that for Central Asia, we will have a chance to share the outcomes of this launch. As mentioned, the WHO Regional Meeting for Europe and Central Asia will be happening next week in Tel Aviv, Israel. And we are working, the outcomes of this launch will be shared to our global team in IFRC, and we hope that it will be included in our statements or submissions to the WHO regional and global meetings. So with that, I would like to thank everyone, and let us keep in touch and see how this guidance can be further used by governments and other actors in the future. Thank you and have a good day ahead.